What is hydrocephalus? Hydros means water and cephalus means brain. Whenever there is excessive collection of a fluid called a cerebrospinal fluid, which is like water, inside the brain, we call it as hydrocephalus. This cerebrospinal fluid is produced, circulated, and reabsorbed on a daily basis inside the brain. Almost 150 ml of it is produced every day, and on an average, around 450 ml is circulated in anybody's brain. This cerebrospinal fluid nourishes, nurtures, and protects and cushions the brain. It surrounds it on all sides. When this water gets collected more and more in the brain due to any particular reason, probably due to increased production of this water or any blockage in the circulation, or if there is a blockage in reduction in reabsorption of this cerebrospinal fluid, it may lead to a condition called as hydrocephalus. This water, when it increases inside anybody's brain, it puts lots of pressure on the person's brain, which leads to different symptoms and signs. What causes hydrocephalus? Hydrocephalus can be present in children at birth. In that case, it will be congenital. But most often, it is noticed after birth, where it can be due to a brain tumor or an infection or due to a cyst. Very rarely, it can be associated with a condition called a spina bifida, where child has something abnormal in the spine but will also have a problem with CSF circulation in the brain. How do we diagnose, or what are the signs and symptoms of a child who is having hydrocephalus? So a child who is having hydrocephalus will generally present with headache, vomiting, vision changes, irritability, and drowsiness. The signs and symptoms in an infant will be different from signs and symptoms in a toddler. In an infant, the skull is very mobile. So in such cases, the skull will keep on growing more and more because of the increased water content inside the brain. So the child will present with a very large head. But whereas in a toddler where the bones of the skull are completely fused, child will present most likely with headache, vomiting, and irritability. We diagnose it by either an ultrasound or a CT and MRI scan. In children that is below 1 year of age who have a soft spot on the skull, an ultrasound is helpful in diagnosing it. But in most instances, a CT scan or an MRI will always be needed to confirm the diagnosis. The treatment options basically involve always surgery. Basically, the treatment options that are available is to generate an alternative pathway to divert excessive fluid that is there in the brain to some other compartment of the body. For this, in most of the instances, we end up putting a device called as a shunt. It's a flexible silicone tube that diverts fluid from the brain, most likely to an abdomen or other parts of the body. Very rarely, we may choose to do a minimally invasive procedure called as an endoscopic third ventriculostomy, depending on how and what are the reasons for the hydrocephalus in the child. For more information on hydrocephalus, please do consult a pediatric neurosurgeon next to you. Thank you.